voluntary assisted dying in Ireland. How will it work? I'm Mark, I'm a GP in Dublin, and I believe that voluntary assisted dying should be legally available in Ireland. It seems really obvious that when a patient is dying and of a terminal condition, they're suffering in the last few months of their life, they should have choice and they should have options. It's become the norm in many jurisdictions internationally, and in this video I'm going to outline how the process might operate in Ireland, what the model of care will be. So how will voluntary assisted dying work in Ireland? What's the model? How will it be implemented? To understand this, there are three components regarding the eligibility criteria of the patient who would then apply for VAD. The second step, once the patient applies, is the approval process. And then the third step will be regarding the voluntary assisted death itself. So I'll speak just very briefly on each of these three components of the model of care. So the first step, if VAD is implemented in Ireland, will be, unfortunately and tragically for a patient, will be the development of an incurable and terminal physical health condition. So this would be a patient who is dying already. The choice of life will have been taken away from them. They may be in the last few months or weeks of their life, and they may be suffering considerably. They will have to consider VAD as an option. The Joint Oireachtas Committee on Assisted Dying has already specified many of these aspects, but a limited prognosis of ultimately around 6 months would have to be present. So that would include cases, patients with advanced cancers. There would be a clause that if a patient has an advanced neurodegenerative condition but still has capacity to make decisions, such as with motor neuron disease, the prognosis could go out to 12 months. It's worth stating that the patient would have to have capacity to make the decision and to understand the process of VAD. So Irish doctors that support medical assistance in dying would also agree with the Joint Oireachtas Committee on this. And this is quite conservative, but it would essentially mean that patients with advanced dementia would be unable to obtain VAD in this model of care. All patients must be resident in Ireland. They must be adults, and there are multiple excluding criteria, such as having a mental health condition as a qualifying condition under the Act. So in this tragic case, if a patient develops this defining condition, the development of an incurable terminal physical health condition, they may end up applying for VAD. So let's look at that process. What happens? So a formal application, sometimes that can be two applications, one verbal, one in writing. That will have to go on, and two assessments will take place. Independent assessments from registered medical specialists. That will be a lengthy assessment process in which capacity is assessed, coercion is assessed, a full medical, full social, full holistic assessment takes place. And each of those assessments will then make a judgment, and that will go towards the approval committee. And if the two assessments say that the patient is acceptable for VAD and meets the criteria, the approval committee would make a decision and grant a certificate for VAD. An independent agency would be created that would be involved in education, postgraduate training, professional development. It would enable peer support. It would involve data collection and monitoring and annual reports, and it would also support quality improvement and research. And there would be sanctions if any of the registered medical professionals operate outside of the Act. So it's robust, and this is kind of what takes place in many other countries, like Canada, like Australia, like New Zealand. So three options will happen. First of all, the the request and application is approved, and the patient would then go on and activate that choice. A second potential option is that the application is approved, but the patient would never exercise the choice. It's just there if they want it, and then they would die, supported by palliative care and their GP. The third potential option is that either or both of the assessors and the approval committee do not approve the application. So the last component in the model of care is the voluntary assisted death. It usually takes place at a patient's home. I would say that there's usually a choice of either a physician-supported assisted death or a patient self-administered assisted death in most models internationally. Where there is choice of both, it is the experience internationally that the majority of patients would choose the intravenous option. In terms of statistics internationally, the average age is around 77 or 74 in Australia. Most assisted deaths take place at the person's home, but they can be anywhere, wherever the patient chooses. There's an equal percentage of men and women. Around 4% of all deaths in Canada now are from voluntary assisted dying. It's around 1% in Australia. And the most common medical condition in terms of the qualifying criteria would be advanced cancer. In terms of the protocols and drugs involved in the intravenous provision, they are clearly set out. They vary somewhat between different centres, but they involve sometimes sedative medications such as midazolam. They involve coma-inducing agents. They're drugs like propofol or phenobarbital. And the third medication would be a neuromuscular blocker, which would cease respiration in the patient, and that's a drug called rocuronium in many cases. So that's the model of care. There's this 3-stage process from the patient tragically developing a terminal condition, applying and going through quite a vigorous approval process, and then if they meet the criteria, are accepted, and then choose to have an assisted death, there is the process of an assisted death. And I would say that at all times the palliative care services are present in parallel. So that's it. That's the model of care in Ireland. When voluntary assisted dying becomes lawfully available in Ireland, this is how it will probably operate. It borrows heavily from other jurisdictions that have legislated and implemented voluntary assisted dying. I have a video on the variety of international models if you want to look at that. It can be enacted through legislation. And if you want to know more about the Irish context around VAD, I also have a video on that. The model is conservative, it's safe, it's what the public want. There are lots of arguments that are sometimes made against voluntary assisted dying, and I've addressed these arguments in another video resource. So I hope you found this video informative. Do follow Irish doctors who support medical assistance in dying, or End of Life Ireland if you are interested. And remember to lobby your TD to legislate for VAD. Thanks for watching.